equal distribution of access to natural areas. In the US, the Trust for Public Land has been putting out excellent publications that document the size and quality of parks, as well as proximity to homes, and how this differs vastly depending upon race and income. And one way to integrate these benefits into decision-making is through the paradigm of ecosystem services. And this is the idea of the benefits that ecosystems and its processes provide for human well-being. And it's been framed primarily in ecology and policy discussions as services stemming from biophysical processes. So water purification, flood protection, carbon sequestration. But there might be a way we could start to think of mental health in these terms too. And so we recently published a conceptual framework that lays out how we might start to think about what we call psychological ecosystem services. And I'll just end with a brief walkthrough of the model. So first, we consider natural features. This is about the elements of nature that potentially influence mental health. It can include the size of the space, so total area, the composition, proportions of different types of natural elements, the spatial configuration, like degrees of fragmentation and connectivity, and other relevant natural attributes. So tree canopy diversity, vegetation structure, species composition, or biodiversity. The second step assesses exposure. So this is a broad term, but here it refers to the amount of contact that an individual or a population has with nature. And this includes those kinds of metrics we talked about, residential proximity, or the ability to travel outside of city limits to larger areas of nature. And the spatial configuration and composition should be considered here as well. So this is different shades of green here represent different types of nature, such as clusters of open lawns versus trees, which are embedded within urban surroundings in different configurations. And we can see that there might be more passive or active exposure to these squares of nature, so to speak, depending upon how that spatial configuration is laid out over the landscape. But the total amount of nature remains the same in all panels, so 34 street blocks. Now, the model should also account for the socio-demographic, cultural, perceptual, attitudinal, and behavioral differences that influence the tendency and ability to seek out and receive nature contact. So measurement approaches based on a location alone can certainly fail to account for differences in exposure that are due to factors such as access to transportation corridors, time demands, income disparities, discrimination, and safety. And then the next step in this model is to consider the types of nature interactions and experiences that occur with each nature contact or each nature exposure. And interactions, we can think of this as different patterns of interactions with nature, or some people talk about dose. So measurements that move from the kind of exposure to the absorbed dose, depending on behavior and other considerations. And then lastly, the effects. So the effects of nature contact are going to vary across outcomes, so cognitive function or mood, stress reduction. Some will relate to psychological well-being, others will relate to relevant factors for the onset of disease, perhaps, and they're going to also depend on socioeconomic status, age, gender, other personal characteristics, and of course, the ways in which people feel welcomed or discriminated against while in natural environments. So here in this conceptual illustration, we can see how these different groups respond differently across different outcomes to different amounts of nature experience, with not all receiving a benefit. And of course, this model is not something that should be applied from afar or without considerations about specific places and social contexts. It's crucial that these decisions are made in close collaboration and partnerships with community members and groups and are responsive to the needs and desires of the people living within the areas themselves. And along with this comes the critical need to deal with green gentrification and displacement forces that can come with green development. So this must be tracked and addressed consistently as well. And with that, I will pause and see if there are any questions, and thank you again for having me here today.
Thank you, Gregory. We do have one question, which I'll read out loud, verbatim. Thanks, Professor Bratman, for this great presentation. Please, did your work reveal any drivers for use of green space, such as pandemics like COVID-19? Any thoughts, please?
Yeah, so I think other members of this panel are going to be more of the experts on the usage patterns of COVID-19 when it comes to green space themselves. So I don't want to speak out of my kind of realm of knowledge there. I certainly have read many papers that have documented this increase in usage. And I think that the patterns of this usage across sociodemographics and other characteristics of users, as was mentioned in the last presentation, are going to be really important to analyze and think about. So yeah, anecdotally or kind of based on my readings, I would say huge uptick in seeking out of nature and challenges that come with that. And I think we're going to be talking about that today.
Perfect, thanks. And you're right, we will pick up on this further. Here's another question, and then we'll go on to Sarah. So again, verbatim, how do we use the ecological ingredients, which is in quotes, ecological ingredients, mentioned by Bratman to increase nature experiences in cities so folks can reap maximum benefits of urban parks?
Great question. So I could go a number of different directions with an answer to that, and I'm not sure I'll get at the intention behind the question, but let me just say what my initial reactions are. So the first is, I feel as though questions like that are the reasons why I try to look at causal pathways. So the more we can know about what ecological features result in what mental health outcomes for whom, the better, and that will help our park design to then incorporate those things. So there's a huge amount of work coming out now, for instance, on biodiversity and the importance of that for psychological well-being. So that would be one example that I would say evidence is mounting to the point now where we want to think about that when we're thinking about our urban parks. How could we increase, say, biodiversity? And that would fall into the category of what I'm calling an ecological characteristic, and other things as well too. And yeah, I could go on for a long time with an answer to this, but one last thing I'll say is it kind of also depends on the theories you're looking at. So if you're looking at kind of a psychoevolutionary theory about that posits a certain type of environment helps you due to our collective evolutionary past and our innate connection to nature, you might think of certain kinds of landscapes, whereas if you're considering past lived experiences, familiarity with certain types of nature and ecological characteristics, you're going to want to take that into consideration as well when you're thinking of an urban park. So that's going to depend on the users too. We can talk more about that later.
Great, and agreed, we can talk about it more. Thank you so much, Greg. Let's go on to Sarah, please. We can see your slides.
Great. Wonderful. Well, I would love to thank everybody for the opportunity to be here. Sorry, let me just get into present mode. Yeah, really thrilled to have the opportunity to be part of this panel today, and really enjoyed hearing from my co-panelists. So I will be in my time giving an overview of the work of the Natural Areas Conservancy as it relates to the care of natural area parkland within New York City, and then through a 12-city network that we manage. We'll give a little bit of context about what we know about visitation and the social experience of park users, specifically within natural areas in New York prior to the pandemic. And then we'll share briefly findings from 3 separate local and then national research efforts looking at the impacts of COVID, both on funding and also on visitation and volunteerism within parks broadly and within natural areas specifically. And then we'll share some high-level reflections about sort of as we've come out of the height of the intensity of sort of pandemic life during 2020 and those initial impacts, some of the trends that we are observing, again, both locally and nationally. So again, just to give a little bit of context about the Natural Areas Conservancy, we are a New York City-based nonprofit organization coming into our 10th year of existence, and were formed back in 2012 with the idea of serving as a nonprofit partner specifically to the Natural Resources Division within New York City Parks, and with the mandate of using scientific research, policy and planning, and in-field restoration and management activities to advance the care of the 20,000 acres of natural habitat which exists within New York City. That's about 1/10 of the city's land area. 10,000 of those acres are on New York City parkland, representing about a third of the city's full park system. I will give just a couple of very brief visual looks at the kinds of places I'm describing, because I think it's sometimes helpful to see the sort of extent and magnitude of the ecological diversity that we are looking at, and also just at the breathtaking beauty of some of these places, which run counter to the mental image that people often have about New York City generally and our park system specifically. This is a maritime forest in South Brooklyn. This is on the other tip of New York City in Pelham Bay Park in the Bronx. This is the southernmost extent of the sort of rocky coastal ecosystems that we see all the way up through New England and into Canada. In Wood Hill Park, this is a forest that was last logged during the Civil War. The average tree age in this park is about 120 years old, so kind of big, magnificent, towering hardwood forest. And then this is one of our many wetland complexes in Staten Island. So prior to COVID, in 2013 and 2014, working closely with colleagues from the US Forest Service, we conducted both a citywide ecological assessment, engaging 25 research scientists over a 2-year period to catalog the extent and biophysical condition of more than 54 unique habitat types on city parkland. But we also conducted extensive interviews and research about the use and visitor experience in natural areas. Just to highlight a couple of things, and this is very much in line with the previous presentations, we learned through this research that natural areas relative to other types of parkland are specifically very important for offering a sense of refuge and place attachment for New Yorkers. New Yorkers are much more likely, and this matches trends across the country, to use areas that are well maintained and also areas that are programmed. And I think in some ways, kind of the most startling, 50% of the people that were interviewed across more than 40 parks during this study reported recreating either in the park where they were interviewed or in other city parks, which really kind of begs the question of the both importance and the sort of quality of resources that are going into providing access specifically to natural area parkland within places like New York. So fast forwarding to spring of 2020, these are just some clippings of articles that came out during the month of March 2020. And we saw, before we actually did any data collection, a huge increase in park visitation, both in New York and around the country, and a huge outpouring specifically of visitation into natural spaces within parkland as people sought to socially distance. Those observations led to and spurred these three research efforts that I'll mention today. The first was an effort led by the City Parks Foundation and the Central Park Conservancy, looking at the impact of the pandemic across all city parks and affiliated nonprofits within New York City. The second is a survey that my organization conducted, looking specifically at the 14 nonprofit organizations that bear a direct land management responsibility for natural areas within the city. And the third is a national study that we conducted, looking at the impacts of the pandemic on both municipal and nonprofit partners in 12 US cities focused on the care of natural areas. So just to give a high-level overview for New York City parks, the Parks Department budget for New York was cut in the highest percentage of annual loss since 1978. The budget was cut by $84 million, and the impacts of those cuts were immediate and extremely, extremely rough for the city. The cut in funding was paired with a hiring freeze. So there was a lot of attrition across all parts of the agency. And that was further compounded by loss of revenue for affiliated park nonprofits of between 30 and 65%. You can see some of the impacts in terms of events being canceled and hours of lost staff time. And I'll say that anecdotally, these numbers contrasted with a reported uptick in visitation across all types of park space. Looking specifically at natural areas in New York City, we saw significant decreases in terms of staffing, a huge impact, especially in the early days of the pandemic, on volunteerism. And at the same time that staff cuts were pushing nonprofits in the direction of looking to volunteers to take up more maintenance and operation functions. And we also saw a real increase in things like litter and sort of non-natural area management concerns that were diverting attention away from the care of these resources and the maintenance of trails and public access. At the same time, we went back and using a similar methodology to the methodology we used in 2013, 2014, collected data about the visitor experience across all 5 boroughs and reported a 65% increase in visitation to natural areas during the summer of 2020. Just to zoom out to this national perspective, this is the map of the cities within our 12 city network. I'll just point out at the bottom here, the green bar represents the total acres of natural area parkland across these 12 cities, in contrast to the acreage of built or manicured parkland. So it's a huge percentage of all parkland across these areas. And in terms of impacts, similar to what we saw in New York City, so an 83% increase, 83% of organizations reported an increase in visitation to natural areas, while there was consistent reports of impacts to budgets and decreased volunteerism and overall management capacity during this same period. So just to kind of give a little bit of context about sort of what we've seen since 2020, one thing that's been very heartening is a tremendous increase in partnership between the public and private sectors, as well as partnership between nonprofit and municipal agencies and non-501c3 groups across all of these cities. There's been a huge increase in advocacy for parks, both in New York and in other places, in large part spurred by the ability of advocacy organizations to tap into park usership and people who have really either fallen in love with parks all over again or identified their unique importance during this time period. We've seen a real resurgence of volunteerism across all types of parkland, and a real commitment from organizations to support the work of those volunteers. And then there's this kind of huge hope of increased funding. In some places like New York City, we've seen a lot of our funding reinstated. Other places have not had that positive experience yet, but are hopeful that a combination of increased local spending or federal funds will bring park budgets back in line with their sort of needs in terms of both direct funding and staffing. So with that, I will stop screen sharing and very much look forward to diving into our discussion.
Great. Well, why don't we start to move into the discussion? And I'd like to stay with you for a moment, Sarah, if I may, and ask, during this time of COVID, do you have a sense in what ways have funding and visitation patterns for natural areas been the same or different for parks in general?
Yeah, so I mentioned locally, we saw this 65% increase in visitation specifically to natural areas. That number is similar to, but a little bit higher than the visitation that has been cataloged across flagship parks within the city. And I would say, just to give a little bit of context, across our 12 city network, the natural areas receive only about 4% of municipal park funding across these places. So we're talking about huge areas with just a tiny fraction of the already limited funding available. So the squeeze in terms of funding cuts has hit these places particularly hard. And it's really diverted, as I mentioned, it's really diverted natural resource management staff from focusing on providing public access in the form of trail improvements and wayfinding improvements, but also, we're just beginning to anticipate some of the long-term potential impacts of deferred maintenance of the ecosystems themselves.
Do you think because of the nature of the pandemic and the need to socially distance, that use went up in these natural areas, or?
Yeah, absolutely. The 65% number is tied to a whole suite of qualitative information about park usership. And I mean, to a T, people reported both, I think, an increased benefit of specifically of spending time in natural areas because they were less crowded and offered more opportunity for contemplation and disconnection from the sort of intensity. Just as like a very small example, especially in the beginning of the pandemic, just the sound of sirens was so overwhelming, even in built parkland, that being able to just get further away from, sort of this streetscape offered a sense of refuge and sort of a decrease in just the sort of adrenaline that I think we were all sort of charged up on here in New York during those early months. And definitely people also directly reference just the ability to spread out and safely unmask and spend time outdoors without feeling the fear of contamination, especially early on when we were still kind of understanding the transmission vector of COVID.
Right. This is a question for Catherine and Sarah, though. Gregory, you're always welcome to join in. Many cities reported increased utilization of green spaces during the pandemic. However, for some cities with more densely populated areas, overcrowding in parks was a real challenge and forced park districts to close green spaces. In other public spaces such as restaurants, new creative strategies like outdoor seating or grab and go options have allowed for adaptation for the unique challenges posed by COVID. Do you think that you've seen any municipalities implementing similar innovative strategies to make room for green space in crowded urban centers? And Catherine, I know that you were showing some slides that actually, made me think of this.
Yeah, I mean, I think that's, I mean, again, I live here in Washington, D.C., and there really has been this, I think, a growing awareness of this public realm, and with the parks kind of bleeding into that public realm. So I think that there have been opportunities for, as I said, cities to make their streets more park-like. I also think that there's been an interesting, use of parking lots and turning those into temporary parks, and whether over time those are used to create more wild spaces in cities is intriguing to me, because it seems to me that they're really, I think when everything shut down, it really helped us understand how much space we actually have that we turn over to cars. And then in some cities where they could actually use those spaces to transform them and make them more people friendly. So I think it'll be interesting over time to see if that trend continues, because when we're talking about parks, we think about these large organized spaces, but if we're going to create healthy cities, we need to have biodiversity everywhere. And so that's in, the streetscaping, and then that's in the way that we are, planting our urban forests. And so I think there's some, I don't have the answers, but I think that there's some interesting beginning to see some interesting trends there.
I completely agree. I'll just chime in and say there was a report that was released last month by the Regional Plan Association that I think kind of highlights some of these issues. And I was going to just share, in New York City, we have 32,000 acres of roadway and right-of-way and 30,000 acres of city parkland. So those numbers are almost the same. And one of the things that's been very heartening about this past year in particular is a sort of commitment to cross-sector collaboration between transportation advocates, greenway advocates, and park advocates, really thinking about how to marry together some of the top goals that they share. We've seen that in the form of sort of cross-referencing each other's advocacy priorities for the mayoral election. There's been a big push by one of the local civic organizations that has been endorsed by more than 100 other nonprofits to create an office of the public realm within New York City that would have sort of a dotted line authority to the Parks Department and the Department of Transportation, as well as other agencies. So I think there's been this kind of grassroots sort of, organic upswell in terms of people, individual residents making those connections, but also a real interest from sort of civic leadership in exploring how to codify and lean into some of those points of interconnection as well.
Well, and this is really interesting, and at least my experience had been that, with the restaurants, in a sense, they were appropriating space because they needed to get outside, in order to stay in business. I hadn't thought about the fact that if people are working from home, there's much less, in a sense, occupation of those parking spaces, right? And you could that there could be opportunities for ground level parking, but also where you have these parking structures, maybe they only get half of them back, and then we're going to use the rest for like a vertical park. That never had really occurred to me, that the impacts of the people telecommuting.
But I think the next wave of this conversation is really going to be about housing. So as we look at, okay, so there's all this space, we have a housing crunch in cities. That sets us up for actually more complexity. I know New York City has seen all these large, dense cities have seen a need for more, low-income housing. And when a piece of land becomes available, of course, we need to provide more housing for residents. But what I'm hearing also from our park directors is that they're so concerned that with all of the projections of increased urbanization and the need for more housing, what does that mean for open space? And as you've heard, if these park departments don't have the budgets for land acquisition, it pits them against developers. There's a real opportunity for low-income housing advocates and park advocates to work together and really think about that intersection of housing and parks and green space as not something that is an either or, but a both and.
Thank you. There's a question here in the Q&A for Gregory Bratman. Have there been any studies on the impact of green spaces for people experiencing homelessness, specifically in urbanized areas of large metropolitan areas during the pandemic?
Great question. Can you all hear me?
Yeah.
I think my internet died for a second there. Okay. Yeah, so the answer is yes. There have been some studies on this, and I'm actually currently working with the U.S. Forest Service, Dr. Lee Cerveny and Dr. Monica Darian, along with some members of my lab, to look at homelessness on public lands. And this includes urban lands and larger, more kind of U.S. Forest Service lands outside of city limits. And so more to come on that. Lots of interviews of land managers, social service providers, law enforcement officers, hoping to actually get firsthand interviews with the folks themselves at some point, and thinking about what are the kind of drivers of this phenomenon, which is increasing a lot and is of large public debate right now. And what are the benefits or disbenefits that these folks are experiencing as they live in these green spaces? And so the best way we feel to get at that is to talk to as many people as possible and use this kind of qualitative interview analysis to come out with some ideas about those things. But yeah, and there are some studies already out by Dr. Cerveny and others from the U.S. Forest Service on this topic, and I'm sure there are other researchers as well. Those are just who I know that are looking at this.
Thank you. And just as an aside, not just because I work for the Forest Service, I think that your work and your work with Lee on this topic has really been transformative and unique. Unfortunately, it's unique, meaning that it would be wonderful to see this being replicated and examined in other parts of the United States. It really is terrific.
Oh, thank you, Morgan.
Gregory, I'd like to stay with you for a moment before going back to the Q&A, because it picks up on a question that came up earlier, and you kind of self-limited your answer.
Oops.
It's good. But the question is, has your research revealed any specific design criteria that increase the extent to which parks support mental health? Do the benefits of parks for mental health vary based on the size, tree cover, or other characteristics of the park, for instance?
Right, yeah, so I started getting into that a little bit. And I, by the way, think that this is sort of the next generation of questions that at least the people, the environmental psychologists and environmental epidemiologists and public health researchers that I work with are starting to look at. So that the way I put it, like how do different types of nature impact different people differently? So you have these psychoevolutionary theories that I sort of mentioned really briefly about attention restoration and stress reduction, a lot of which kind of posit that urban environments tax these faculties of us, so they deplete our faculties of directed attention, and the natural environments help in many ways, in kind of like precognitive ways, restore our attention, restore our cognitive function. So you see these like studies that look at working memory improving after a dose of nature, or the parasympathetic nervous system, kind of the rest and digest restorative system coming online, in contrast to the fight or flight sympathetic part of the autonomic nervous system, providing you with that kind of restoration and stress reduction that's rooted in that psychoevolutionary theory. And so that kind of claims that areas like savannas or open spaces where you could, as we evolved in these landscapes, see oncoming predators, see where our food and water sources are, or trees that are not overly dense, so they allow for visual sight lines. And if you look at attention restoration theory, give us a feeling of extent and compatibility and these other kinds of factors that they mention that are kind of helpful for us in a restorative way. So that's like one set of considerations to think through. The other I also mentioned has to do with the lived experiences of the visitors themselves and the associations they may have with different types of nature, with memory or other aspects, and sense of place came up in my co-panelists' talk. That's really interesting to think about. And this connection or association that's been shown to develop over the life course from childhood to adulthood, depending upon kind of parental preference, your own experiences. And so that really emphasizes that importance of familiarity, or even how these places feel like home to folks. And on that, some initial work I'm doing with a collaborator, Dr. Hector Olvera Alvarez, he works with participants and folks from El Paso, Texas. And he's found that they prefer and may even receive some more psychological benefit from desert exposure versus green exposure, which is really interesting to think about, given their familiarity and likely much more daily contact with those environments than the small pockets of green that do exist in El Paso. And then the last thing I'd say is about the design. So we talk about affordances or trail design, and my co-panelists would be much more experts on this than I am, but how do you design a trail? What kind of nature contact does it encourage? What kind of nature interaction does it encourage? What are your amenities in the park? Like, are they culturally relevant for the people living around the park? Are you providing amenities for them that they want to use and that are preferred by them? And other things like, what's your signage like? Is it inclusive signage? Is it speaking about environmental history that's not limited and speaking to all users, and speaking about our environmental history in a way that's extensive and not limited. So those aspects are also really important to think about.
And your answer reminded me of, many of us are familiar with crime prevention through environmental design. And, what is this other side of the coin, which would be mental health maximization through environmental design. We have examples of environmental design being used to prevent things here, thinking about maximizing as well. There's a question here that I'd like to direct to Sarah, if it's okay, and you can duck it if you want. The question is about language. There's talk about greening streets, but this is often small plants and planters, which are not always maintained or sustained or not native and perennial. Can you talk about who is keeping an eye on this? And I think the eye is on the topic, not necessarily the planters.
I want to make sure I understand this question.
I think their point is that with the maybe existing or maybe with the expansion into the streets of these new kinds of parks, there's this greening up, but it's with plants that maybe are not maintained or they're not native, that there's missed opportunities in really thinking about this new form of green space. And so
sure, yeah, well, I guess I have two thoughts that come to mind in response to this question. The first is the real benefit of taking a holistic approach to goal setting and prioritizing how natural spaces are distributed across the city, and thinking of them as part of a larger whole rather than thinking of them as discrete individual programs with separate goals. We've been involved in New York City in a collaborative effort called Forest for All NYC, which has, for the first time in the city's history, put forth a vision for the entire urban forest, inclusive of private property and individual homeowners and campuses and green infrastructure and street trees and natural areas, and having that big tent framing that allows you to create high-level goals, including goals about the protection of biodiversity and native plants, and then to create context around places where that type of planting or prioritization may not be viable because of the stressors on plants in specific areas, but having that sort of acknowledgement and planning happen at that larger scale feels really, really important. I'll say, and I think many folks listening to this probably know this, but it is extremely stressful to be a street tree, and the native species that we prioritize within our natural areas and the ecosystem function that we're really striving to reinforce just doesn't make sense on the streetscape in the same way. We're looking to make sure that the things that are planted on streets and on private property aren't inadvertently undermining the ecological integrity of our large natural areas, but we by no means think that those should be, apples to apples in terms of what gets planted and the kind of care regimes that they require.
Right.
Yeah, I'll stop there, I think.
That's great. And I guess to amplify that point, our team is looking at biodiversity, current street tree biodiversity in Baltimore, relating it to historic redlining and urban renewal. And we see that there's a big uptick of tree planting in redline neighborhoods, and it's all red maple. And so I went to our forestry division and said, well, why is it all red maple? And they said, it's the only thing that will survive. So, they're addressing the absence of tree cover, but there's still a biodiversity impact simply because of what can survive. But at some point you have to, it's a question of what can survive. I'd like to turn to a question that's been posed to Catherine, but I'd like to bundle it with one that I had. So the co-occurrence of the pandemic and the Black Lives Matter movement was a moment of both challenge and opportunity for organizations, institutions, and businesses across the country. I'll add here, and this is the question that appeared in the Q&A, also this link between housing and parks. is an emerging theme as we have this housing crisis, both in terms of urbanization, but also because of evictions. So what lessons has the Parks Alliance learned during this time related to the pandemic, Black lives, and housing and parks? And are there places that, not only lessons, but places that you would point to that you think are really good examples of successfully trying to address these questions?
Sure. Yeah. So, at the very beginning of the pandemic, what people were really interested in was, how to manage, as we've talked about over, all the increase in use and communications and programming while social distancing. And then we got into how to program for during the summer with summer camps, and then, how to maintain connections with community residents. And out of that, what I'm seeing is a really interesting attention to addressing inequitable systems. So there's been a shift to how to build an equitable and inclusive organization in many of these agencies, how to build a diverse workforce for 21st century parks, as we've talked about, looking at tree selection and maintenance, but also the cultural side of managing parks, how to partner with communities to build community ownership, connecting brown and Black youth with nature, using parks for equitable and inclusive economic and community development, using data. There's been a really interesting trend to look at data sets and how park departments can actually draw on information about health and air quality and access to make decisions about how they're going to use their existing dollars to serve the communities that need the park space the most. So this idea that it's not just about programming, but we really need to look at the underlying systems that are causing the inequities is something that I think has really come out of the pandemic. And in terms of interesting examples, I think one of the best is here in Washington, D.C. There's the 12th Street Bridge project, which is a former bridge that's being turned into a park. But there's been an emphasis on just stabilizing the community on one side of the park, that to make sure that when the park goes in, it doesn't experience the kinds of displacement and green gentrification that we've seen in so many areas. So they're looking at how they can, make sure that there are policies in place so that people have access to housing and the jobs that will come and the business opportunities, and kind of, laying the conditions that'll ensure that when the park goes in, that the people who've lived in those neighborhoods really benefit from the added benefits that the parks will bring. A second example is India Basin in San Francisco, where there's been a very intentional approach to a new housing development in an area of the city that was under-resourced, but there's a very strong equity component of that development where parks are woven into, not only the development, but how decisions are made. So those are two that I would raise as good examples across the country.
Well, thank you for identifying some ones that stand out for you. I know that all of the cities have to be your favorite children, so do appreciate that. And I'll just add as a context. Well, so I've been with the Forest Service fairly long, and I'm getting to the point where I don't really care if they fire me. And in 2018, I said to leadership that I really thought that we should study the relationships between institutionalized racism over the past 100 years in parks and in forestry. And I was told that would be a career-ending decision. And go forward a couple years, and now the Forest Service is like, can we please have more and more of that kind of research? So there has been this transformation on the research side as well as the policy and planning, and it's hard to appreciate it unless this rapid change, unless you're as old as me, to see how this has really changed, and it creates hard conversations, right, about equity and how has it come to be, and what are we going to do about it, and who's going to be involved. So it's great that there are some examples that you can point to. I'm going to come back to you, Gregory. There's a very specific question. What has been noticed about the connection with homelessness in parks?
Well, I feel as though I need to wait on that until we're done analyzing the data. So I don't want to get ahead of the paper there, but conclusions to come. I'd say that, you know, there are a plethora of factors that are driving that that phenomenon. So
I'd like to turn to a different question for you, Gregory. Specifically, your research demonstrates that parks can improve mental health by giving people access to fresh air, space to exercise, and a place to engage with nature. However, according to a 2020 study, parks can cause stress if they're not safe. Furthermore, the Central Park birdwatching incident illustrated the reality of racism experienced by Black park users, which is a major source of stress. Overall, it seems that parks can be places that improve mental health and can also contribute to stress. How can we resolve these two conflicting realities when it comes to parks and mental health?
That's a great question. First thing I would say is I absolutely totally agree with the heart of the question, as I think you could see from the opening of my presentation. I would start by stating that my research does not show that the beneficial effects of nature experience are always present and always constant. These factors and other social and cultural factors are a huge issue that have to be addressed, and they have to be integrated more explicitly into the work, into the environmental psychology and epidemiology studies that focus on nature and health. And I think there's a huge move to do that, which I'm very happy about and working hard to be a part of. And safety is a huge concern. You know, there have been studies that have found, unsurprisingly, that that gender and ethnic and racial characteristics and factors, these can play a huge role in how safe visitors feel and are in these spaces. Christian Cooper example, unfortunately many others, including those of another African-American birder, J. Drew Lanham. I don't know if people are familiar with his work, but it's fantastic. And work by some scholars that I had on a slide earlier, Drs. Roberts, Finney, Byrne, Hoover, and Lim. They're just working to demonstrate how this power and privilege and racism in these spaces these are critical to consider when it comes to the benefits that they provide. And, you know, I think a lot of times we talk about equity and inequity when it comes to access, and that's essential to address. But we also have to talk about the equity and inequity of the experiences themselves that visitors have when they're in these spaces. So that's also an equity issue. And, you know, a lot of these spaces have been designed by and for a white demographic. And so we should be aware of that when we talk about the benefits also. Yeah, I can stop there, but critical question.
That's really helpful. And by the way, if people have not heard of J.D. Lanham and read his work, you really should. It's really terrific stuff. And I, you know, you said this point about it's designed, you know, for a specific group in mind. I think it's important to emphasize there, you know, also gender as well, right? In terms of what, you know, do you feel safe and don't you feel safe? Or not necessarily designed for specific gender, but it's sort of the notion that men are the normative and everyone should feel the same, right? There's no sense that there could be a difference. Is something to keep in mind.
Morgan, I'd like to add, we, City Parks Alliance, participated in some research a few years ago with the Rand Corporation, where it was a national study of neighborhood parks. And we looked at 25 cities around the country and how those neighborhood parks were designed and used, and whether they were promoting or preventing people from getting their daily amount of physical activity. And you know, you talk about gender, you know, what we saw, and I'm just generalizing, is that they were, you know, designed for fourth grade boys because there were so many baseball fields in them. You know, I love fourth grade boys, but there really was not a sense that the parks were designed for people of all ages, from kids to seniors. You know, seniors represent 18 of the population. We only found 4% in these parks. And so I think there's a history of how these parks have been designed that is what we're seeing today. And we need to look at all of these issues to make sure that we're meeting this diversity of needs across gender, age, ability, as well as all the racial, ethnic, and cultural identities. So it's an interesting time for parks, again, because I think there is this newfound awareness of how these places have been created for a very small portion of the community.
Right. I have other questions, but I would prefer to not ask them and give you a little bit of time to, are there questions that you would like to ask each other?
I have a question for Sarah, if I could jump in, and maybe Gregory, if you've done research on this. So what I'm very interested in this relationship between these natural areas, which are so critical, and access, and how you work with the transportation department, or what you're seeing in terms of providing those links to to enable people to get to places that maybe are a little far out, but still within either driving distance or a ride on the bus.
Yeah, it's such a good question. I feel like we have sort of a concentric circle approach, if that makes sense. We do a lot of community engagement and engagement with local park managers to understand where within a given park people seek to go and where they are accessing from sort of an immediate adjacent neighborhood, sort of where trailhead access makes the most sense, and then layering in considerations about transit and access as it sort of ties us in, especially in a place like New York City, into public transit, because we have the lowest usership of private vehicles in the city, and a lot of even our large parks don't have designated parking areas. So we're really looking at ways that people can access these spaces through public transit. So when we do the process that we go through is we basically sort of one park at a time, we look at all of the existing infrastructure for access, including trailheads and the sort of physical footprint of where trails exist. Frequently, the work itself is actually a significant reduction in the overall trail mileage rather than the construction of new trails, because so many of our parks have huge informal trail networks with no formal signage or intentional wayfinding, but then layering in information from community members about points of access and accessibility has been a huge interest of ours. I think one of the things that feels challenging is it's very easy, relatively easy to change where a trailhead is located. It's somewhat easy to think about kind of connections to greenway infrastructure. It's almost impossible to get an agency like New York City Transit to change a bus route. So we do kind of an iterative process thinking about kind of limitations and opportunities for improved access. And we have identified a real opportunity as a coalition member of some organizations that are leading efforts specifically on transit accessibility to kind of feed priority projects into their platform rather than to take that topic on ourselves, because it's such a politically bureaucratic endeavor.
And I'll just jump in and give one specific example here in the Seattle area, which I think might speak to this question. It's called Trailhead Direct, and it's a partnership between King County Parks, Metro, Seattle Department of Transportation, and other community groups. And it is designed for a number of reasons, including decreasing kind of parking congestion at trailhead sites outside of the city limits. We have a lot of great nature outside of Seattle, but who can get there is a big question. And so this service, one of the intentions behind it is to bring folks who may not, who are kind of underserved when it comes to this transportation out to nature outside of the city limits, give them some opportunity to take this bus route out there. So I've been part of kind of preliminary discussions with some community groups and some other researchers to try to see if there's a community-based participatory research way to engage and think about whether people are experiencing mental health benefits from this bus service. And there are groups that are doing this also without me. So I think it's an interesting space to watch here in Seattle.
I have a question that actually I'd like to pose to all three of you, which is when it comes to, so it goes to parks, it also goes to volunteering, and it goes to the mental health question, which is there a place for, there was this discussion about design elements and related to mental health, but is there a place for volunteers for sort of semi-active ways of being available in natural areas, programming to take walks, leading meditation, that I don't want to make it sound like it's prescriptive, but in a sense that there are human beings helping to facilitate the mental health benefits in natural areas. I wonder if you have thoughts on that topic, particularly, during times of COVID, but also stress related to, Black Lives Matter.
I can say that we've made a very conscious decision to shift the structure of our volunteer engagement over the last several years. It started prior to COVID, but COVID has really reinforced the change, and we've pivoted. We've almost completely discontinued doing sort of one-off volunteer events with individual groups, and we now focus very intentionally on building a sort of smaller but more engaged cohort of community volunteers that get trained over a series. It's sort of in a master gardener model. So we train people to work with a fairly high level of independence, and then ultimately to serve as community ambassadors themselves, rather than trying to spread our staff of 20 across 5 boroughs with 2 hours of transit between our sort of northernmost and southernmost parks. And that's had a ton of benefits for us in terms of the quality of the work that is conducted, but also in terms of the quality of community engagement that we receive, because these are community members working in their own neighborhood parks who become very knowledgeable about the technical side of their work, but also have a level of connection and insight into the needs of park users that is very hard for us to gain and replicate given this size and distribution of the work that we do. And I think it has had a bunch of secondary benefits in terms of the kind of those sort of opportunities to layer in things beyond just a technical work product, and we're really interested in exploring that further.
Catherine, I don't want to jump in if you were about to.
Go ahead.
I'll just mention another kind of volunteering that I've noticed, which is, based on Shinrin-yoku, or what we're calling forest bathing here, and those who get trained and certified to lead forest bathing experiences in parks. That's become, I don't know the data, but I believe increasingly popular, at least here on the West Coast, from California up through Oregon and Washington. We're seeing a lot of that happening. And so that's another form of kind of a guided mental health therapeutic experience, often by volunteers under the kind of design of this approach. And then also horticultural therapy, of course, looking at this. And I don't know if the Master Gardener program and kind of links up with that approach and those principles, but that's happening as well.
And Catherine, did you have a comment?
No, I was going to talk about forest bathing as well. So
Okay.
we've seen that here.
Great minds.
Wonderful. Well, it's if if I had a earpiece and I was doing the nightly news, the editor would be telling me it's time to wrap it up. So, I'm being told it's time to wrap it up. I want to offer my sincere gratitude to all three of you for the time that you took to prepare for this, your presentations, and the very thoughtful questions and answers that we had. It was really wonderful. I can't speak on behalf of everyone, but I can speak for myself that I really enjoyed this and I really learned a lot. And so with that, I'd like to say thank you. And I'm going to turn it back over to Command Central and Burke Auditorium to Karen Cito.
Thanks, Morgan, and thank you to the panelists. This was so interesting. I took lots of notes and learned a lot of new ideas. I'd never heard of forest bathing, so I'm going to look that up. Those of you at home or on your mobile device, we're on to our final presentation for the day. We're closing it up with Dr. Shannon LaDeau. Dr. LaDeau is a disease ecologist, and she's a senior scientist at the Carey Institute of Ecosystem Studies in Millbrook, New York. Dr. LaDeau received her PhD at Duke University and completed a NSF Bioinformatics postdoctoral fellowship with the Smithsonian Institute and The Ohio State University. Dr. LaDeau is an expert on how environmental conditions shape populations of disease-carrying animals, such as mosquitoes and ticks, to reduce human exposure to Zika, West Nile virus, Lyme disease, and other infections. Dr. LaDeau integrates empirical and statistical work to understand and forecast how changing climate and urbanization influences invertebrate disease vectors and associated human risk. She is especially interested in the social and health consequences of feedbacks between socioeconomics and ecological habitat condition in urban ecosystem studies. She is also an associate editor-in-chief for the Ecological Society of America's journal, Ecosphere. So I love this. We've bookended the day, started off the day with a disease historian, and now we're ending the day with a disease ecologist. So over to you, Dr. LaDeau.
Thank you, Dr. Cito, for that kind introduction, and thank you all for sticking it out on a Friday afternoon. And I have really enjoyed this, so I'm really grateful to all the speakers that have come before me. And why isn't this? There we go, sorry. Clearly, okay. So I'm hoping that you can see my screen now. So somebody will have to let me know if you can't. The speakers today have been really wonderful. It's been a great day, and I'm really grateful to everyone for putting this together. So I am going to talk about something slightly different, and hopefully draw attention to how different things we've heard during the day are really applicable here, or what I'm going to talk about is applicable to the other things we've heard during the day. Let me just make sure this isn't anyone telling me you can't see it. Okay, so I am going to talk about arboviral transmission. And so I wanted to start out with just defining what arbovirus is. And hopefully you can see a pointer here. Okay, so arboviruses in general are viruses that are transmitted by an arthropod, so a mosquito or a tick would be an example. And generally we think about zoonotic arboviruses, those things that have an animal reservoir and only make it into humans as a very rare event, because in this case, what's shown here is like a West Nile virus cycle. A mosquito has to bite a bird that's infected, survive long enough to then bite a human. And that actually is a series of events that's not all that common. If mosquitoes are around birds, they generally stay around birds and bite them. And that's how the virus builds up in the environment. Now, there are a handful of, let's see if I can hide this. There are a handful of species, a handful of examples where that zoonotic, the non-human reservoir is no longer necessary. Examples including chikungunya, dengue, yellow fever, Zika. These are viruses that can now be transmitted by a mosquito from one human to another. It's important to note that these all once did have a zoonotic reservoir that was not the human, and they have adapted, evolved, so that they can now replicate in the human enough to reinfect a mosquito. And I point this out because it's happened almost predominantly with just a couple of mosquito vectors. There are over 3,500 different species of mosquitoes in the world. Most of them don't bite humans. And there's really just a handful, and predominantly 2 species of Aedes mosquito that have played a prominent role in this adaptation to a directly transmitted human risk. For some reason, this doesn't want to advance. Okay, so this is not where we generally are concerned about mosquito-borne disease or tick-borne disease. Most of us from 1950s up through early 2000s would not have considered this ecosystem somewhere where we need to pack our bug spray, for instance. However, that is changing. And the reason we don't necessarily, one of the reasons we haven't worried about mosquitoes as much in these regions is that mosquitoes are actually very sensitive. And believe it or not, they're very difficult to keep alive in a lab because they have very limited thermal ranges. They require very specific temperatures and humidity in order to survive and fly around. They only need blood in order to produce eggs. So they only take a blood meal when they need to reproduce. So only the females bite, and all other energy is fueled by plant nectar. So in many cases, the male mosquitoes are predominantly pollinators. They also have this very long aquatic phase, long relative to the adult phase often. And so the aquatic phase can be a week to multiple months in some cases. And a lot of the ecology happens during that aquatic phase. They're in water. That's where they compete. That's where they're often predated. What type of food falls into that water, which is often fueled by vegetation detritus, is very important for what type of mosquitoes emerge, how big they are. It does affect their fitness as adults, and it affects their fitness as competent vectors of disease. And of course, it's the blood meal that is the reason we worry about mosquitoes transmitting disease. And I could give this talk based on ticks, and many of the things are very similar, although they don't have the water requirement. And I'm not largely because I think the jury's still out on what tick risk is going to be in cities moving forward. And it's actively changing as well as mosquitoes, but it's a little bit further behind. So in recent decades, even though I've just told you why we don't see mosquitoes in these urban areas, which tend to be very dry and hot and have extreme environmental variation, we actually, since 2000, have seen an uptick in vector-borne disease in urban areas. And I'm listing just some of the examples from the US and kind of Western Hemisphere here, including dengue, chikungunya virus, and Zika virus. And these are, dengue has been spreading and becoming more of a problem across urban areas across the globe, and I'll talk more about it. But I put up chikungunya and Zika because these are things that we didn't even know about as being potential for human viral disease risk prior to when they showed up in the Western Hemisphere within the last 10 years. One obvious reason we might think about when wondering why we're getting these urban viral cycles increasingly would be the fact that everything is warming. The global temperatures are warming worldwide. That's the figure down here showing temperature anomalies from the EPA. And mosquitoes, while they're sensitive to heat, everything slows down when it's cold. So it is true that one reason we have not had as much mosquito-borne disease in the Northern Hemisphere is that, or at high latitudes, is that winters are a hard stop. So when a population can grow for 3 months, but then has to overwinter and stop growth, that is a very different population cycle than when the growing season is longer. And so warming temperatures undoubtedly do influence the reason we're seeing more vector-borne disease. but it's not the only reason, and it may not even be the predominant reason. This map shows dengue risk. This is from 2010 from an article by Ba et al. And this is a map of dengue outbreaks due to Aedes aegypti, mosquito here. And dengue has increasingly over the last several decades become a leading cause of morbidity and a real concern for mortality across the globe, not surpassing malaria, but it is becoming of more concern in many areas than malaria. It has an urban focus. It does not require that zoonotic reservoir, and Aedes, this mosquito species, does very well in urban areas. And the reason it has this urban focus is largely because of the water availability in many of the more tropical urban areas where maybe water scarcity or water access is less reliable. You get much more water storage in urban areas, and these mosquitoes have really exploited that and become human specialists. So this is one of the only species that is this globally widespread and really will search for a human blood meal. And it's also true, so it looks like there's a very tropical component to where dengue is, which would mean that these increasing temperatures should allow for expansion of dengue risk into areas that are going to be warming. But I do want to point out that the human behavior and the water storage, and then human behavior being people outside more and more access, not behind window screens and air conditioning, is also different in this same band. And so both things play a role in limiting where Aedes aegypti is. And of course, in 1950 through 70, the US, for instance, treated very heavily urban areas with DDT, which eradicated this species locally. And it has been kind of creeping back northward, but it does not yet, hasn't established much above Florida, although there is a population that is established and persistent in DC. However, it can't just be temperature, because we have history of mosquito-borne disease, which spreads all the way up through, you see this is Portsmouth, New Hampshire. This is yellow fever, also an epidemic transmitted by the Aedes aegypti mosquito. And obviously Portsmouth, New Hampshire is much cooler than the tropical regions I just showed. And so again, this points to the fact that we used to have much more mosquito-borne disease in cities than we do today. And so warming alone or cannot explain why we see an increase now because it wasn't warmer back in the 17 and 1800s. Things that have changed in addition to warming are 100 years of removing water from cities, paving cities, and providing water security. So people in the US and in most of Europe aren't storing water in ways that this particular mosquito, Aedes aegypti, can exploit in the way that people do more in the global south. Again, DDT was very effective at eradicating this species along with many other things. And people after the 1950s have really spent much more time behind window screens and in air conditioning in parts of our country, in parts of the US and other countries where they can afford to do so. However, there's also been increasing cases of these arboviruses in cities that aren't changing the infrastructure in ways that I just described, that have had that infrastructure in place and are now starting to see dengue outbreaks. And that's true for certain places in the US. It was true for Miami and the Zika outbreak. And this is an example of a 2014 dengue outbreak in Tokyo that ended up causing human mortality and was a localized outbreak for that year and has not, luckily, been problematic since then. So they were able to eradicate it, but is believed to have initiated with exposure in a park. And so the green spaces here on the map are parks, and the circles are places where exposure was suspected. And the filled in circles are places where they tested mosquitoes and they were positive. So we have a very, this is a picture of Yoyogi Park here. And we have a focal outbreak around parks in Tokyo in 2014 of dengue. And notably, this was not an Aedes aegypti transmitted outbreak. And so it brings us to the other component of what has changed is that in addition to Aedes aegypti, which you can see, this is from Kramer et al., a map showing where Aedes aegypti is with the black dots and the color coding showing probability. Black dots are observations. It's predominantly tropical. Again, it is not overwintering rigorously. Aedes albopictus, on the other hand, which is also the tiger mosquito, was introduced in the 1980s with the global tire trade out of Asia, and has since become a dominant species across urban areas in most continents. But you'll see it's really much more of a temperate, it is doing much better in temperate areas, including the US here, as parts of Europe, as well as obviously being problematic in Brazil. Aedes albopictus lays eggs just like aegypti on dry surfaces like this. They have a diapause stage, so they can survive winter or drought for months in this stage. In their native range, they would have been laid on the side of things like these bamboo shoots. These are very small bodies of water. This means that as they were moved in tires to urban areas, they are particularly well suited to developing through to adult stages in other small bodies of water. They develop rapidly. And 3 days to a week, and they're opportunistic feeders, so they will bite whatever seems to be most abundant. Again, in their native range in Asia, they were sylvatic. They were 4 species, and they bit small mammals, and were not a huge concern for human disease. But that has changed as they have moved to cities across the globe, and most likely to a city near you. So range expansions is definitely the result of all of those things and the outbreaks. I mean, so dengue virus was not an issue in the US or Japan from 1950 through 2000. And then we have all of these cases, and I believe there's a 2018 one. So it's now being seen more regularly in Florida. It's a huge issue in South America and Tokyo. And I believe France this past year. I mean, they're just more and more dengue is showing up in cities. We also have to acknowledge that there are more people. There are more people in those cities. So if you've got a mosquito that's going to pick up an infection from a person and pass it to another person, having a lot of people in a dense space makes that easier. And people move about a lot. And so it would not be reintroduced into these cities if people weren't traveling from other places infected. For the most, to the best of our knowledge, dengue, chikungunya, Zika don't have an animal reservoir in cities across the globe. And so when it shows up in the city, it's coming in an infected traveler. But cities are also changing and in the way that they're greening and the way that people are using those green spaces. And we've just heard a lot about that. And there are so many positive reasons to have green spaces in cities. And so nothing I'm going to say should take anything away from that. But as several of our speakers pointed out, not all green space is the same. And so obviously we have a picture here of COVID in New York City Central Park. And this is a picture of one of my study sites in Baltimore, which is also a green space that's not heavily used by people, but is one of the places where we interact with residents and they interact with mosquitoes. The rest of the talk, I'm going to focus in on a case study that I've been a part of in Baltimore, Maryland. And I know Baltimore Ecosystem Study was already introduced by Morgan. Dr. Grove, thank you very much. So I won't go into it, but it was a great logistical platform to start to look at some of the questions I have. And Baltimore has such fine scale ecological and sociocultural heterogeneity within the city that it's very tractable for looking at big ecological differences in condition within a radius of places the mosquitoes could get to, but also places our researchers could get to quite easily. And what I mean by that can kind of be exemplified by this map here, which is a Baltimore City map showing the black dots are vacant lots and buildings. So population in Baltimore has decreased over the past multiple decades, and it's left behind a lot of empty buildings and vacant lots. And those, unsurprisingly, are abundant in places that the 1930s and 40s practices of denying loans to Black families were most common. And so this is the Hulk, the federal Hulk security zones, where red was deemed hazardous and the orange was deemed declining. And so people trying to buy homes in those places were less likely to get grants and funding. And that legacy, again, from the 30s and 40s it's really still very evident. And so much of the research refers to this as the redlining. And this has created a lot of heterogeneity. Again, if you look just in the red area here, so all of the work I'm doing is in the red and orange area, but parts of it have been gentrified and parts of it have not. And when it hasn't been, there's still really high numbers of abandoned buildings and just lack of management until an entire block of row homes falls down in many cases. So the questions we went into it were, how does that neighborhood condition influence mosquito abundance? How does that influence resident exposure and risk? And how does that actually feed back into neighborhood conditions? So if you're going to put a community garden into a neighborhood that has a lot of mosquitoes in it, people may be less likely to want to use and maintain that community garden or green infrastructure, for instance. So that was the initial platform, and we went out for several years and we went along to every row home on the blocks in neighborhoods that were either above the Baltimore city median of about 42,000 in 2014, neighborhoods that were below it, and neighborhoods that were right at that medium. And we looked at juvenile mosquito habitat, we did resident surveys, and we also sampled adult mosquitoes. So tons of data. And in general, when we're thinking about disease risk, more female mosquitoes means more risk, more exposure risk. And we found more female albopictus, that's the tiger mosquito, in the low income neighborhoods, that's the black line, than in the higher income neighborhoods. And in fact, we found about 3 times more mosquitoes in our lower income neighborhoods. The lower income here, I'm going to use as a term to capture a whole bunch of different socioeconomic status and cultural and racial components that do all correlate with income. So we can't separate those apart. And in this case, obviously I showed the redlining map. Income and race are highly correlated and again, can't be teased apart from this. The Black communities are still in the neighborhoods that were originally disenfranchised or disinvested in because they were Black communities. In the lower income neighborhoods, we found far more container habitats, and they were mostly discarded, meaning they were unmanaged. So if you went and sampled a tire one year, I was able to go back and find it again the next year. And we did actually do a tire cleanup. So I want to make it sound like we sampled it every year. We cleaned stuff up after 2 years of sampling. In the higher income neighborhoods, most of our container habitats were managed. People put them there, and when it rained, they emptied them. And when it was dry, sometimes they watered them. And this is work that Danielle Bodner and Eliza Little both worked on. And in general, we found that where we found more juvenile mosquitoes, we found more adult mosquitoes. And contrary to our expectation, where vegetation was high, we had mixed results. In the higher income neighborhoods, vegetation was a negative predictor of mosquitoes, and in the lower income neighborhoods, it was a positive predictor of mosquitoes. And that initially confused us, but then we looked back at our data, and in fact, this is vegetation cover, and it's pretty high in the neighborhoods. These are our low income neighborhoods, and it's pretty high in our high income neighborhood. And it's actually only low in the median income neighborhood. And it corresponds to the abandonment built in the lower income neighborhoods. So again, green is not always a park. And to make that a little bit more visual, these are 2 blocks in 2 different neighborhoods. The left-hand one here is low income, the right hand is high income. And you wouldn't be able to tell from this view, they both look pretty green. But when you drill down into this bottom corner here, you see that the green looks a little pretty clean like this. And they've got rain, you know, our main container habitat are rain barrels and the bottoms of containers that people put out there for plants. But when you do the same thing for the lower left-hand corner of our low income block, hopefully you can see that these 3 row homes here are all missing their roof. And that's where the trees are. So in the lower income areas, the trees are actually growing out of the roofs of these buildings or behind the buildings where nobody else lives. And that's where you get illegal dumping. And so when I say we sampled more container habitat in the low income areas, it's not because of casual littering. This is not a resident responsibility. These are illegal dumping of you know, there were 7 toilets here. This is some like 40 tires, in addition to the smaller things that tend to collect around that. So undoubtedly, these disinvested neighborhoods, which are currently disinvested in and have a legacy of being disinvested in, are very productive habitat for mosquitoes. And we see more juvenile mosquito development in these areas, and we see about 3 times as many adults. The mosquitoes are bigger. This is more abandoned buildings over here. This is a bigger mosquito. And you can see the example, we do it by wing length, and bigger tends to mean more fitness in our mosquitoes. So this is an area of research right now. Why are they bigger in the lower income neighborhoods? We also see a difference in what they're biting in with neighborhood income. And we can look at the DNA in the mosquito gut and see that the proportion of blood meal that comes from a human, and it's actually pretty low. It's less than 20% of the blood meals in low income neighborhoods, and upwards of 50% in the high income neighborhoods. And in the low income neighborhoods, what makes up the extra 80%? It's mostly rats. So if you're in the high income neighborhood, you're most likely to be bit by a mosquito that last bit a human. If it's the low income neighborhood, you're most likely to be bit by a mosquito that just bit a rat. And obviously there's fewer people in places where there's more abandonment. So one result is that when there's fewer people, they bite something else. But we also learned for our surveys that residents are less likely in lower income neighborhoods to use their yard or use a local park or garden. So less than 20% of, on average, our residents in the lower income neighborhoods said they use these local green spaces versus closer to 75% in the high income neighborhoods. And when we asked people, where do you spend time outside? Again, in the high income neighborhoods, we got a lot of yards. And in the low income neighborhoods, the most common answer was on the front stoop, the curb. And this is what it looks like in many of these neighborhoods. All that green space that I showed you in the previous figures is behind the row homes. When we sample for mosquitoes in between the row homes, it's too hot. There's no shade and we don't find mosquitoes. So there's lots of reasons to think risk is higher in the low income neighborhoods just based on density. It may be pretty high in the high income areas based on who's getting bit, although the mosquitoes are still 3 times less abundant. But the human context of risk is really tricky and something we're still working to understand. When we asked residents what their top environmental risks were, in low income neighborhoods, they told us trash, rodents, crime, and trees. And at first this was upsetting. But then we realized when we gave people cameras to go out and take pictures of what stressed them out in their environment, these are the kind of things they take pictures of. It's not the tree that I think of when I think of a tree. It's the tree growing out of a building. It's a tree associated with trash. In higher income neighborhoods, they said trash, rodents, and mosquitoes. And folks told us in 2016, after Zika became something of a concern, that 75% of people were choosing to stay indoors to avoid mosquitoes rather than use their own yard or parks. So in high risk, in low income neighborhoods with high abandon, you've got fewer people, more mosquitoes, but less demand for control. People are less likely to report it as a nuisance, less likely to call it in as a nuisance. And so they're also less likely to get any municipal control activity. In the high income neighborhoods, you get more people, fewer mosquitoes, more calls for control, but it might actually be less effective to do it in these neighborhoods. And we still have a lot to do on what it means that they're more likely to bite humans twice in those neighborhoods. The highest risk is probably in our gentrifying neighborhoods, which I didn't talk a lot about because they honestly fell right in between. And they fell in between because it's block to block. One block looks like the low income neighborhood and the next one looks like the high income neighborhood. You have both very adjacent mosquito habitat and high densities of people. And this is often where people are really trying to do greening activities. It's also important, and I'll end with this statement that we've heard several times today. Many residents, even in US cities, do not have screens and they don't have air conditioning. And they're also often the same residents that are most likely to be exposed to things like mosquitoes in this instance, and less likely to be tested for infection. And so these are pockets of areas in our cities where you can actually get amplification of things like an arbovirus built up, so that by the time it starts infecting people in the numbers and in the neighborhoods where it's going to be detected, it's already pretty well established in the area. So many people to thank. It was a huge project that I only touched the tips of. We did lots of citizen science, and mostly thank you to the Baltimore City residents who made it possible. Thank you.
Thank you so much, Dr. LaDeau. That was so interesting and such an interesting way to wrap up the day. We're almost out of time, but I'm hoping that we have time for one question to you, which is connecting your talk with the last panel about trees and parks, and I'm wondering if you can talk a little bit about what this means in terms of having more people having access to parks, but at the same time, the risks associated with spending time in parks, especially the example that you gave with Japan.
Right. Yeah. I mean, I think it's a real issue. The risk is so relative, and so, you know, the mental health concerns and that folks have talked about, people are at higher risk of suffering from those than they are of, you know, getting a mosquito-borne disease and dying from it. And so at that course level, the parks are absolutely necessary. The water habitat for mosquitoes makes it a fairly straightforward target for control. You know, one of the things that happened in Japan is they had no idea that there was even a risk. And so these mosquitoes are in water habitat for a big part of their life. And if we can figure out where the habitat is and either remove it or treat it with something sustainable, then you can actually be pretty effective at minimizing that risk. I think looking forward into the future, the bigger concern is going to be, you know, certainly across the northeastern US and the Midwest, is what do we do when the ticks get into these places? You know, we definitely found deer blood in the mosquito guts. We know there are deer accessing in the urban areas. And that's how ticks get dropped off. We actually found ticks at our mosquito sampling sites a couple times in Baltimore because they're attracted to the CO2. And they're a lot harder to control once they're there. You know, I think we have a window of time to try to minimize the establishment of tick populations. Just like in the Northeast, we have a window of time to try to minimize the Aedes albopictus population growth that's currently occurring. And whether or not we have the capacity and bandwidth to do that, I think is you know, a big question. But it's going to be an increasingly important problem for urban parks.
Okay, we have time for one other question. Colleen,
I want to ask this on behalf of an audience member named Carolyn, who asks, do you have much faith in the newer mosquito control methods?
So I assume that's partially a question about kind of genetic modification, or the Wolbachia, the kind of actual modifying the mosquitoes in order to control the mosquitoes. And there are some really effective methods that are being developed and have been tested and proven. And they're very effective in places where you can control the population access, right? So on islands. You know, I think that there's some really effective methods that are going to be useful in places where malaria is a huge concern, or in very limited areas where dengue is a concern in a tourist area, for instance. In urban areas, the so the mosquitoes in our study, we don't think they move much from one block to another. And so, you know, it would probably be more effective in that case to remove all the habitat at the juvenile stage than it would be to try to release enough male mosquitoes to hopefully change the genetic or microbiome of the females and have population control that way. So I do have faith in it, but I think it's most useful in specific circumstances and not currently going to be useful in the types of habitats and places I just talked about.
Thank you, Dr. LaDeau. Thank you. And I want to thank all the panelists and all the speakers for today for a really interesting set of talks and discussions about COVID and the future of cities. I want to thank the Hixon Center for Urban Ecology, Colleen Murphy-Dunning, and her staff. And for those of you joining us at home, we will have the videos of today's talks posted up on the Hixon website shortly. So thank you very much for joining us and have a terrific day. Bye-bye.